Hi guys, hello everyone. So, ngayon papunta ako sa doktor ko para sa physical kasi may maintenance na medication si Lola. So, ayun, nasa parking lot ako guys. Dito din naman ako nagtatrabaho noon. Yung doktor ko ngayon, siya yung pinagtatrabahoan ko noon for like 13 years. Full time din yun nung nagtrabaho ko sa kanya. And ngayon, nag-home health ako guys. Kasi pagka sa home health, pwede namang pwede nang nagpa-part-time lang nga ako sa home health. Pero yung oras ko nga is full time over pa nga. Kaya sabi ko minsan nagfo 14 hours ako sa trabaho ko sa home health. Pero ngayon, sandali lang guys. Pero ngayon, yung being part-time, I have a lot of free times. Ngayon, yung doctor ko, like I said guys, I like to use the steps. Yung doctor ko na I have to see now for a physical, it's on the 3rd floor. So, I'll be using the steps to go in there. So, yun nga, part yun sa mga exercise ko guys. Kahit ilang steps, kailangan gagamitin ko yung steps for my benefit. So anyway, itong doctor ko ngayon guys, like I said, I used to work for him for 13 years. Tapos when I changed job to home health, so siya pa rin ang family doctor ko because I know him. I know he does good. So, ayan. So, yun yung cousin ko yan, guys. Ang doktor na to, siya yung cousin ko. Kiniklaim ko siya na cousin ko dahil may 1% daw siya na Filipino blood. So, hey, I said, why not? Cousin na kita ngayon. So anyhow, I'm gonna check in guys, and well, of course, they do well, height, weight, vitals. By the way, I already got done my I have to put my mask on. I already have done my blood work the other day. Just a second. Guys, I just saw one of my favorite patients when I used to work for this doctor long time ago, and I bet they can recognize me too, because I'm kind of hard to forget, really, I think. Well, not really, but anyway, I'm going to check in. Yeah. Guys, yung asawa ko nandito rin. kasi itong physical namin, I make the appointment para kaming dalawa magkasama. Isa rin yung doktor namin, pero nag-drive kami dito ng separate. So, ayan. Pagka yearly physical kasi guys, may maraming mga questionnaire. So, ano na ngayon sa questionnaire. So guys, kasama sa questionnaire ang depression questionnaire. So, yung depression questionnaire guys, kasi is, parang ano lang yun, parang basis lang baga. Kung halimbawa in the near future, magkaka-depress ka, so may basis na sila how long you have that feeling. So, parang it's part of the physical, like I said. Pero ngayon, yun nga, tapos na ako. Yung asawa ko naman ang nag-a-answer sa questionnaire niya. I can barely talk as always. So anyhow, yeah, ang appointment ko kasi is 20 years, 20 minutes earlier than his. So that's why we just drove separate so that, just in case pagka tapos na ako, aalis na ako tapos siya na rin doon. But I will know also kung ano yung mga resulta niya dahil yung nga cousin yung doktor namin cousin ko. So guys, ito yung lobby ngayon. Ah, wala kayong makitang tao dahil pagka dumating dito yung mga pasyente, dadalhin nila kaagad sa room para hindi makapag-expose sa virus. So ayan. So guys, with my blood test, as part of what we discussed on my physical is my blood test result. I had a blood test or blood work done 2 days ago before my appointment because I'd rather do that so that on my doctor's visit we can talk about it. So with my main concern also is my cholesterol. My total cholesterol it's really not really kinda, but it is high. According to the total range that they would like for an individual to have a total cholesterol of 200 below. Now guys, mind you, mine is 277. But okay, at the beginning, when the nurse called me and let me know of my total cholesterol, I was a little bit worried, but then I was wondering, I was thinking, okay, my total cholesterol is high, but I have to kind of find out what is my HDL and my LDL to kind of make a judgment to it if I need a cholesterol pills or not. So my LDL it's 183. Of course, the national range that they would like to have is 150 below. So I am above 30 points above, 33 points above the range that the American Heart Association would like to maintain a certain number of the LDL. But I'm thinking, okay, so 183 for my LDL, my total cholesterol is 277. Somewhere along the line, I'm sure that my HDL is high. So just to kind of give you a little thrill, the HDL, which is the good cholesterol, the range that they would like it to be is 40 above, and mine is 75. So the reason why my total cholesterol is 277, it's because my HDL, the good cholesterol, kind of almost like up there, close neck to neck, almost, not quite, but neck to neck, almost to my bad cholesterol. So my good cholesterol is trying to compensate, kind of balance out my bad cholesterol, so that makes it higher. But then even with my total cholesterol of 277, I do not really need to take any cholesterol lowering pills because my good cholesterol will fight that off. But what I can do though is modify my diet. No mukbang, guys. Aray ko, no mukbang. Wala nang mukbang tayo, guys. Kasi yung mukbang, kahit yung mga mukbang ko, kahit salad, pero yung mga topping sa salad, it's not good for my cholesterol. So, those kind of type of things that I need to modify. And especially, I'm not really into sweets. And I'm not really, see, that's another thing. I used to not eat rice too much. But now with that mukbang, it kind of triggers my rice cravings. So I'm supposed to lower that to help with my triglycerides also, because the triglycerides, when the triglyceride is what will make or causes the bad cholesterol, the LDL, to kind of keep rising also. So it's fun, right? It's just a physical, it's just a doctor's visit. But I was kind of trying to try to help everyone also kind of to understand, especially with, I'm little, I'm not too big, I'm not heavy or anything like that, but my cholesterol is higher than my husband's. But of course, my husband is taking cholesterol lowering pills because his good cholesterol is not as high. His is only like 45, 43, something like that. But of course, the range is kind of like 40 above. They would like to make it higher. So mine is 75. So that really kind of offset my bad cholesterol. So that's why I don't need to take right now. Not yet. But yeah, it's kind of one of the things that I would like for you guys also to know, that for example, the cholesterol, you can control that by modifying your diet. Not so, guys, everything is good. So I guess for now, oh guys, you would not, I don't want even to do it, but since I'm up there age-wise, I have to do some kind of special diagnostic testing, guys. So it would not be fun, but those are the things that we need to do. At least I have my mammogram this year, and I have my vaccine. So one more test. It's probably, I would rather have it done probably end of the month, no, end of the year, towards the end of the year, 6 months from now. So yes, guys. So anyway, this is not too much of like fat and carbohydrates, like rice. Like I said, with my coffee and my drink and stuff like that, I'm not into like too much sweet. Not to mention, guys, that I just made that a few weeks back, I just made the mango float. That's not good, but that's probably what causes my triglyceride and my cholesterol, bad cholesterol, high. But anyway, like I said, modifying it, although I always kind of do my exercise, it's better to watch the diet, because our diet is really what makes us or breaks us. So it's just part of the things, because everything that works internally, it also shows out physically, outside. So yeah, diet is the main thing. Exercise, diet, and more water, guys. That's what the main thing to keep us going and keep us healthy and pretty. Yeah, only in the dreams, right? But just not just for fun. I just have to put that in. So kaya guys, maraming salamat sa panonood ninyo, at maybe you learned something today, especially with diet and exercise, and water and fiber. So like vegetable, utan lagi day. So yeah, I like vegetables too, but like I said, with the mukbang, that's probably what I need to cut off much, because with the mukbang, that's what makes me eat a lot of rice. and a lot of and dessert too, so, and a lot of noodles. So you guys please kind of take care of your health. It's cheaper to take care of our health than to go out and take more pills. And speaking of which, pills, medication, that is what I'm trying to say. Speaking of that, my blood pressure, it seems like it's not getting any better. I guess it runs in the blood, it runs in the family. But also at the same time, I got excited. It took them like 40 minutes to take me to the room, and I was thinking, it's supposedly, if I did not come up to the front desk and tell them how long I've been waiting, I don't want to be like the, what do you call that, they call it, well, this is our terminology while when working at the doctor's office, GP's office, we all call it the hypochondriac, things like that, the grouchy patient, troublemaker. We don't want to see those kind of patients. So when I was there waiting, I was trying to hold my horses. I'm trying to hold my horses. I hold it tight too, guys. But after 45 minutes, I went ahead and tell the front desk that, yeah, I've been waiting here for 40 minutes. What's up? So, and I even texted my cousin, my doctor. I said, hey, I'm supposed to be there now. What's going on? I know he's a very nice doctor. I like him a lot. Like I said, he's my cousin, and I worked for him for 13 years, and it was a fun run. But now, like I said, I am doing the home health, which is, I like it better because I only work part-time. So, part-time, I can take my day off anytime I want to. I'm not obligated to show up. I mean, when you work, you want to show up. I have a good record of attendance when it comes to working. But I guess what I'm trying to say is that if I don't feel like working, I can just tell them that, I don't want to work today. Or I tell them tomorrow, like, for example, I will tell them today that, tomorrow I have other things to do, I cannot come, and that's cool. It's nothing like you have to be there, you have to be here, and then you cannot. If you not show up, then you'll be written up. You'll be in trouble, another incident, and I don't want that. So that's why I'm enjoying my part-time job. So anyway, guys, thank you so much for watching. I hope you guys enjoy and learn a little today, and you guys be safe, and I will see you soon, guys, in my next vlog. Bye.